your Houston chiropractor, Dr. Gregory Johnson. We have Ian here with us this morning, and Ian has been a patient here for just a little over a year now, huh, Ian?
Yep, that's about right.
And, you know, just like 50% of all Americans, when Ian came in, one of the symptoms that he told me about, besides his mid-back pain and spasm, was his chest rib pain up here, as well as having acid reflux and hiatal hernia. Now, he had already seen a gastroenterologist, correct?
Correct.
And had a scope done,
Correct.
and been diagnosed with hiatal hernia and acid reflux.
Correct.
And when you first came in, this is a scope of practice issue here in the state of Texas, which some people are getting all up in arms about. Me treating patients that have hiatal hernia, that's just like when I had asthma in the 6th grade, and 2 years of medical specialist and cortisone inhalers and all these medications and allergy shots twice a week for 2 years didn't work all the way through the 8th grade. And then finally my mom took me to a chiropractor, and he adjusted my lower cervical upper thoracic spine. Well, the chiropractor wasn't treating me for asthma, the disease, just like I'm not treating Ian for acid reflux, hiatal hernia, the disease. I'm treating him for what chiropractors have been trained to and licensed to treat, which is subluxations in the spine, which can affect the internal innate healing ability of the body to heal itself. And as a result of this, over the past year, Ian, how's your acid reflux and hiatal hernia with your body healing itself from what we've been doing versus taking all the pills and potions and stuff that they've recommended?
If it was like a 9 or 10, it's now like 1 or 2. It's vastly improved, so almost non-existent most of the time.
And we've been treating you for subluxations in
Yes.
your spine, not your acid reflux or
Right.
hiatal hernia,
Right,
correct?
exactly.
So for all of you out there who have questions about me treating people who have acid reflux / hiatal hernia, know this: I'm treating the biomechanical improprieties of the spine and the rib cage that affect the innate healing ability of an individual's body to heal on its own. And that's what chiropractic's always been about, is innate intelligence healing itself once it's allowed to do so without interference from subluxation. So we're going to show you how we do that. Let's take a look here in the mirror, Ian. Let's have you flex forward and then backwards, and then neutral. Yep. Okay, Ian. You're not too bad off today. A little bit curved in that mid-thoracic. There we go. It's gonna feel tight. I got these big old new pins.
Yeah, we're good.
They are good. They don't hurt the hips as much.
No, not at all.
Now when I adjust the spine like this on the y-axis, I'm adjusting the cervical, thoracic, and lumbar spine, all 24 freely movable vertebrae. But especially in this upper thoracic, mid-thoracic, lower thoracic region where the ribs attach to the vertebrae in the back called the costovertebral joint, and then those ribs go around all the way to the front to the costosternal joint. If those ribs and thoracic spine aren't lined up properly, it does not make for a smooth dome of the diaphragm. That's where the hiatus is. The hiatus then gets kind of tweaked and out of alignment and lets the stomach slip up in there and secrete acid into the esophagus. That's what acid reflux is. But as you can see, one more, there it is. I'm not treating his acid reflux. I'm doing all this without drugs or surgery. Dropping. That's it. Way left. There you go. Good man. All right. So hopefully this will put to bed any rumors or accusations about me practicing outside my scope of practice in the state of Texas. There we go. Okay. Okay, good start there. Legs are even. Stay even. That didn't hurt too much, did it?
Nope.
I'm still going to adjust his pelvis. Both sacroiliacs in the sacrum, and then L5, L4, L3, L2, L1, and now we're moving into this lower thoracic region. Okay, just exhale for me. There we go. I still got some right here. There it is, right there. I knew it was there. All right. This probably even feels easier than the first one.
Yep.
Okay, you're gonna feel your head popping up a little bit on this next one. There. Good. Okay, let's turn you on your back now. Good. Now let's slide you down this way a little bit. Put your arms out like this. There we go. Good. Okay. I'm going to have you take a deep breath. Now what I'm doing right here is I'm getting a deep contact on the anterior part of the abdominal muscles, the fascia, and I'm pulling down right here, which pulls the fascia and therefore the stomach down below the diaphragm. All this is muscular in nature, musculoskeletal in nature. I'm not treating his organs or doing surgery on his organs or prescribing him overdoses of Prilosec and Nexium. There we go. Chiropractic is a drugless and natural treatment. There we go. Okay, let's sit your face toward Joseph here. Treatment that does not utilize drugs or surgery, but relies on the innate healing capabilities of the human body once it is allowed to function without interference from subluxation complex. Good. And Ian's referred his entire family in here, as well as other people, and it's not because I've treated his acid reflux or hiatal hernia, it's because he feels better as a person, right?
Absolutely.
Alright, let's have you flex your head forward and backwards. Oh yeah, perfect range of motion. See, his posture is way back up. Just a couple of little things here. There we go. Okay, now let's have you flex forward and backwards again. That's on a swivel. That hurt at all?
Nope, feels good.
Good deal. So, Ian, what would you tell people about your experience here at Advanced Chiropractic Relief?
Very positive experience. Don't pay for a surgery. You don't need a surgery. The surgery doesn't work. Just come here, get healthy, and live your life normally.
Thank you for sharing your experience.
Thank you, Dr. J.
This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, where we treat people for their biomechanical improprieties and vertebral subluxations, not organ-related diseases. We'll see y'all soon.